National Health Insurance Authority was down about 121 million. Why so? I mean, from 22.
Honorable Chair, thank you. Honorable Chair, basically this was due to a reduction or decrease in the levies, which was about 100 million from between 2021 and 2022.
Why people were not paying?
That's the National Health Insurance levies, the collections.
Okay. Now let's look at your expenditure. Let's look at your expenditure. Claims of service providers in 2022 went about.
Honorable Chair, this was due to the increase from our claims bill. That's about 500 million, and it was due to increase in medicine list.
And look at your ID cards and biometric expense. It went from 53.7 million to 84.8 million. Why that big jump?
Honorable Chair, thank you very much. This was due to our target increase of our membership, the registration of the total population of the nation.
But it looks like every time we
have to reach universal health coverage by 2030. So we have even limited time to get there.
So a surplus of 606 million in 2021 ended up being a deficit of 178 in 2022.
Honorable Chair, very well. As I said, our claims will increase by 500 million, whilst the National Health Insurance levies decrease.
And we're looking at your current ratio as of 2022. It's 1.9 to 1. And in the case of 2021, it was 2.8 to 1. What has been the current trend now?
Honorable Chair, the current trend has improved because we have received more monies from Controller. At that time, there was significant amount in receivables, that is arrears.
So we should have hope in National Health Insurance Authority.
Honorable Chair, there is hope.
Good.
Chair, just to inform the House that at the moment, the National Health Insurance is doing prompt payment. So, in fact, the allowable period for arrears per the tradition or precedence is 3 months. But as I speak to you now, they pay almost every month. So if there's any outstanding for any service provider, then maybe the service provider hasn't brought their claims. So every month we do payment. And the Minister for Finance has also been very, very cooperative and helpful.
It is good, Honorable Minister, that you say that, because NHIA, there was always an issue about non-payment. So sometimes you go to hospitals, they wouldn't take your card and everything else. All right. That's good. Now let's go to management issues. Let's hold on for a follow-up.
In a year where you claim they reduced your income, the incomes that came to you, we saw your non-current assets moving from 98 million in 2021 to 310 million. So I'm thinking that you're saying that not much was given to you in the form of levies, and then you chose to spend on plants, buildings. Because in 2021, where you had 2.2 million, you spent just, your non-current assets was 98 million. And then in 2022, where you claim your income was reduced, you rather short up your non-current assets at the expense of what? Claims, payments, or what?
Honorable Chair, thank you very much. This was due to the payments made on ongoing projects that we completed in the year.
So it's not like you had money and you were able to use some to complete your project. So it wasn't like the incomes or the levies that came in was not enough, because you even had more to increase your non-current asset by over 200%. So when you are stating your finances, you usually state it in that terms, that because you were here saying that we saw a loss, a deficit, because your levies came down. Where what? Your nose was. And I think in explaining, you just have to put that out there also, so that you create a true and fair view of the accounts and proceedings as it's at the National Health Insurance. Thank you very much.
Well noted, Honorable Chair.
Now let's look at the management issues in this on paragraph 723, and Honorable Bauer will take care of that.
Thank you, Chairman. The third infraction relates to non-transfer of funds from SNIT. And the auditors are saying a receivable amount of 564 million, 948,323.34 Ghana cedis was not, could not be traced to any bank accounts of the National Health Insurance Fund as at the time of the audit. And if you go to 725, they are saying that the situation makes it difficult for the authority to meet its objectives as set out in Section 40 of the Act that establishes you, Act 852, and therefore recommended that all the transfers and recover the outstanding amount. Can you walk us through as to whether you've been able to recover this receivable that we were supposed to receive from the SNIT? Auditor General, can you confirm?
Honorable Chair, the entire...
Chairman, I think that should be all. But let me also commend the leadership of NHI for the human job that you are doing. Now we no longer have the calls from our clients that I've been to the hospital, they are saying my NHI card is not working and I need to go and buy drugs again. So, Dr. Bompa and your team, a part of your back, and then we plead that at least you continue with the good work that you are doing in line with the reset agenda of President John Dramani Mahama.
We thank you very much, Honorable Chair.
Minister, this is a public interest question. And, oh, Minister, this time you are wrong, because it's, you don't know what I'm going to ask. My issue has to do with, the medicine list, the medicines list. How does a drug get onto it? Do you look at diseases and illness that are common and prevalent in our communities before you put them there? Because 2 days ago, Minister, you came to Parliament to answer a question on the hepatitis B issue. You hardly find it. We know vaccines should be relatively cheaper to buy, but that particular hepatitis B vaccine, prevention vaccine, I think it's around the top list. So I'm asking, how does a drug get onto the medicines list, and and there are certain drugs that many Ghanaians...
Honorable Chair, this is a very important question. The Ministry of Health sets up a group that considers the current disease trends and the kinds of drugs that must come onto the list, and we are all stakeholders of that group. And that brings up the standard treatment guidelines. And I'm saying it's important because yesterday we had a stakeholders conference where NHIA brought together all the stakeholders. And exactly this same drug vaccine that you're talking about, it came up. So it's one of the things that we're going to be looking at to put on the list.
In terms of their medication, is there a way we can get it on, get some relief?
Before I come to this question, the issue about the hepatitis B that came up on the floor were of two legs. One was about the vaccines, and the other was about the treatment. And so the vaccines, I informed the House that plans are far in advance to include it in the traditional immunization. I informed the House. Then my attention was drawn to the fact that there are some medications that are used for the treatment are not on the National Health Insurance list. And so I assure the House that that will be considered, and then I will make sure we'll put it on the National Health Insurance list. But it must go through a process. It must be convincing. We must establish the need for it and all that. But I think it's a very important issue we need to, consider. Yeah.
Minister, finally, yesterday you held a press conference on the Minister. I told you I'll be asking
So
for
you
better.
didn't disappoint me at all.
Yes, Minister, I told you. I told you I'll be Minister. For me, my issue has to do with the fact that the contract was for a certain number of networked hospitals or health centers, and you have out of the 900 or 950, correct me please, 450 has been done, and per the payments that you claim has been made, the total contract amount was 100 million. 77, did you say 77 or 76 has been paid? And you're saying that it is more than the work that has been done. Minister, have we taken steps to find out from the vendors, one, why they failed to scale it to the amounts that they have been paid? And two, you said now moving forward, we have a new vendor. And so is the new vendor going to clear the outstanding? Or that's the difference of the 450 less the 450 less the 900. That difference, is the vendor going to get them on board, or the vendor is going to start, a new vendor is going to start all over? Thank you.
Thank you very much, Chair. As you recall, I responded to this question on the floor of the House and per the standing orders of the House. Under normal circumstances, I should not be repeating it on this committee. But then, Mr. Chairman, I will take the challenge and give the committee the explanation very well. So I will take the challenge up. Mr. Chairman, we inherited an electronic system that an agreement was signed in 2019. The contract sum was $100 million. They were supposed to connect about 950 health facilities. The contract was supposed to expire 3 years later, so that will come to 2022. At the end of 2022, they had not connected all the 950. Some other reasons were given for the underperformance. Now, the government then extended the contract to expire in 2023. 2023. At the end of the 2023, again, not all the 950 facilities had been connected. The government again extended the contract to expire on the 31st December 2024. So something that originally was meant for 3 years has been extended to 5 years. Now, out of the $100 million, about $77 million has been paid. Now, when we came, under normal circumstances, the contract was divided into what we call milestones. So when milestone 1 is completed, it must be given to the state before you even go to milestone 2. And that was what the ministry or government should have insisted on before even allowing the next milestone. And that was not done. And so when we took over, when the contract had expired, so issues of abrogation or termination doesn't arise because there was no contract. It doesn't arise because there was no contract. Now, what we said was that before we take over, we must know what we are inheriting. And so a forensic audit was conducted, and we saw a lot of gaps, especially the hardware. You realize that issues of quantity, issues of quality of materials provided were not up to specification. They quantified that, and that was about $18 million. There were other issues. Again, as part of the third milestone, they were supposed to connect about 157 facilities. And the government paid about 10 point something, almost $11 million. That, again, shouldn't have been the case. Because, no, it's part of the 77. Because it is not meant for pre-finance. You execute the contract and you pay. But the government at the time paid. So out of the 157 health facilities that must be connected, only 7 were verified. 7 were verified. And so today, it will interest you to know the immediate past health minister clearly admitted in his his write-ups and circulating that the contractor has been overpaid. I'm not saying it. And so when we came, we said, wait a minute. Now there are gaps. I invited him to the ministry to have a conversation with him because under normal circumstances, we should have access to the data. And Mr. Chairman, in all this, what is very important and sensitive is not even about the gaps or the money issue. It has to do with our data and access to our service. National security is a national security issue. So what we said was that you should have handed over to the state. Now, the state doesn't have access to our data and our service. And so we are ready because the software doesn't belong to the state. It's a service maintenance agreement with you for 2 years so that we will not experience the disruptions we are experiencing at the moment. When we got that, but before we do that, give us access to our data. Give us our service. The contract, yes. Mr. Chairman, at this point, let me put my CEO for National Health Insurance on the spot. He was one of the people who led this negotiation. I didn't seek his permission to put his name out. That's why I'm saying I'm putting him on the spot. He was one of the people who led this negotiation. Because at a point in time, I had used all diplomacy, so I had to stay back in the interest of the country. That's why you don't want to know the other tangentials. But I had to stay back to push some of my CEOs. Mr. Chairman, for your information, we were not dealing with a reasonable human being. And so he said we should take that one out. And again, instead of us verifying 450 health facilities, he says, no way, put in 461. Yes, that's why I have cited with him. And switching the thing on and off because we had no solution. At that point, I had to take a bold and courageous decision to find a solution. And what is the solution? The solution is that the country must own the software. And even if the country was not owning the software, and we had created a middleware, an exchange, where any vendor will plug in, even if any vendor is bluffing, we could have secured our data. We didn't have that. And so for the past 2 weeks, Mr. Chairman, the whole system has been switched off. And that is why you hear issues of National Health Insurance card were not being verified. Mr. Chairman, you hear issues of we are going back to the paper system and all that. So, Mr. Chairman, what I think is important and Ghanaians must know, and Mr. Chairman, we didn't respond to all these things because we thought that it was not for the ministry or the minister to come and lament. We should have solutions. Mr. Chairman, we had no option than to engage and to have a software that is for the state. So we are working on the software that is for the state, which is now, instead of the LIMS, which is the Light Wave Health Information Management System, we are working on Ghana Health Information Management System that the state will owe. Now we have put in place the middleware that even if we are inviting more vendors, they will come and plug into the system and that the data will be lodged into it. Now the second leg of your question about the remainder, the 500, because he has not done the 500, and one of the issues why we are where we are is that the system was monopolized. If there were about 4 or 3 or 2 vendors, maybe if he's maybe squeezing out, but we have to deal with this emergency situation. So what we have done is that we are rolling out the software. We have a 4-week plan. We are doing the piloting. All other agencies are on board. Medical superintendents are on board. CEOs of the various agencies who are interested parties are on board. AG on board. Yoko on board. NITA on board. All other cybersecurity, everybody is on board. Where we have to retrieve what belongs to the state, the appropriate agencies will deal with that. For now, the ministry's target aim is to look at how we can get out of this mess, Mr. Chairman. Thank you very much.
Minister, you see the platform I gave, initially you were reluctant to respond. But you see, this platform is for free. You are not paying any money, you are not paying for any item 13 because, it is here and we are taking care of all that. Yes.
You know you are Abena
No,
and I'm Kwabena. You are Abena and I'm Kwabena.
Minister, there's one thing I want. You mentioned that the minister said, the former minister said, the vendor has been overpaid, and it's in. I
have a write-up. Seth, if you are here and you are listening to me, please give me my file. Mr. Chairman, today I woke up to a response from the immediate past minister.
Okay.
And Seth, are you here? I woke up to a response from the immediate past. And if anything at all, you should be keeping quiet. It's not in his interest to be talking because he overpaid the contractor.
Minister, respectfully, if you can go straight.
So
yeah,
I read.
So, yes, because
Mr. Chairman,
he's not here. Yeah,
this is one of the things he said. He said that payment have been 62% from the Ministry of Finance. So he has admitted that about 77 has been paid. And $23 million outstanding. Now hear this. As of December 2024, reconciliation should be expended by the vendor. And he is the one who paid this. Why should you be talking?
So, Minister, well, this does not translate into the person has been given, but hasn't been utilized.
No. Mr. Chairman,
yes.
This is not a prepayment procedure. So you pay as and when you have executed the job. So if you are paid more than the work you have done, you have been overpaid.
And you said the minister said that.
Yes, yes.
For me, that is what I want to establish. The
it's
former
out there.
minister
So the
said
impression
that
should not be
the
created as
vendor
though
has been overpaid.
Yes, Mr. Chairman. So the impression should not be created as though saying this doesn't mean overpayment. That's number one. That impression should not be created. And then maybe he should come out to say he didn't write this. But this is what he has written.
Since this has come up at a Public Accounts Committee meeting, which is live everywhere, Minister, if you could give us a copy of that so that it will be part of our files. Of the
Mr.
copy
Chairman, a
of
copy
the,
of
the minister's
Okay.
a copy, the document that you read from.
No problem. I can staple them together.
You give us a copy.
It's been
so that-
titled, what is the title?
that will be on our files. You can get it later and give it to our clerk.
Okay, so it's been titled The LIMS Controversy, a case of giving the dog a bad name to hang it. That's
Yes.
the title.
So when we get a copy.
No problem, no
okay.
And it's signed by.
No, I didn't say it's signed. I said this is what he has put out there.
And
so
is it in the name of them? You mentioned that it's in the name of the immediate past minister. That's why.
Yes. So
It has that indication
it's
on
a
the
former,
document.
Yes, it has that indication on there. It says a former Minister for Health, Dr. Okoboy writes.
Okay.
So,
Okay.
and it's all over social media. I mean, Ghanaians listening to me know,
Well,
I mean,
I haven't seen it, but we'll be happy to have
you
a
are
copy
the only
of it.
person who have
Yeah.
not seen it. You are the only
To
Well
have a
noted.
look at it, and then,
Well noted,
and then
Abna.
we can take that.
Minister, the explanation. Honorable Kwabena Akando, thank you for the explanation. And as you rightly pointed out, you saw this thing on the internet. It could be the case that it wasn't written by the immediate past minister. So I will plead that we'll disregard that until we can authenticate that it's coming from the immediate past minister. Number
Honorable-
two,
Honorable member, that's why I said we need a copy to be on our files.
yeah, I wanted to place emphasis on it for everybody to know that it's just, he saw it, Okuboy right.
Mr.
It
Chairman,
could be anybody's.
I said
decision.
so. I didn't hide it from the committee.
Yes.
It's exactly what I said.
So that
And I
which
put
is,
it on
very
record.
good. But my
And so
point
I'm
is
saying
that you
unless he
shouldn't,
says
you shouldn't have
he has-
made,
See, I was not even
you
going
shouldn't
to
have done
respond
it. You
Mr.
went
Chairman-
extra mile to have said that you shouldn't have done it.
Mr. Chairman,
Meaning that if
I don't intend this banter.
No.
I put it on
Okay,
record
my next
that I was not even going to.
Okay, Minister, that's fine.
So, yes,
that's
yes,
fine.
yes.
You said what you said. Ghanaians are listening, so we heard what you said. So let's move on. So let's move on, please. The second one is, you said you've gotten another contractor to continue the project. Did I hear you right, please?
Mr. Chairman, unfortunately, I didn't expect this. If I was going to do this, probably you would have informed me in advance to bring the necessary documentations, and I thought that I was going to take the opportunity to explain to you what really has happened. So, Mr. Chairman, I with the greatest
Honorable
of
Minister.
respect, where I have gotten to, if you indulge me, I think we will leave it here.
Yes. Honorable Minister. No, it's a question you can answer. You ask him if he has another contractor or not, right?
On the project.
On the project.
Yes. I heard him saying something like, track whatever he said. Then I will also take my question back.
Ask him a question.
Yeah, he hasn't answered.
Okay, he will answer.
Thank you.
Mr. Chairman, if you need any better and detailed particulars on this matter, I can assure you, you can invite me at any time and I'll appear.
Thank you.
Thank
so
you.
that's his answer.
Chairman, sorry, please. Is it
That's
the case
it, that's
that
his
is it the
answer.
case that he's retracting whatever he said?
No.
Until
No. This is live. We all know it. He says if you want better and further particulars on the contractor or whatever is going on, he's ready to give
okay,
it to
that's
us.
good. Thank you very much. The reason why I asked this question is the fact that he, please, Honorable Akando, please, Honorable,
Respectfully.
please, Honorable,
Respectfully.
please. I know. He spoke about the fact that the contract, the first one, wasn't done properly, if you like, among other things. So I wanted to make sure that this one is entered into was done the proper way, so that we will not go back to the same problem again.
That wouldn't be for Public Accounts Committee to find out whether he did it right or wrong. What we are asking for, no, he will provide it. All right, Honorable Gapen.
1 minute. Chairman. Minister, Mr. Rankin is here saying after what we will ask for you to provide, but it's just a word of caution. That as you said, you needed to get a vendor to bring about solutions to the issues you were facing. Please take note that it's today, it's immediate, you needed to do something. When COVID came in 2020, we needed to do something quickly. At that time, everybody saw the urgency, the need to sort of cut short some steps and then get to solutions. Today, it may be the same thing, but I'm only urging you to be very cautious, because today we understand, we are in it. We need that data, because what is the use if you can't have your previous history when a doctor needs to take care of you? But tomorrow, after the problem or the solution has been found, nobody will remember that it was urgent, and so you needed to do some things to cut short certain processes in the procurement chain. So this is just an advice to you, because I have seen some before. In the COVID era, we needed to cut short certain steps to provide needed essentials to our citizens, waiting to them, and even to the doctors who are taking care of them. So this is just a cautious a message to you, that in you coming out with processes and solutions, to solve this particular problem, let's look at the processes so that 1-2 years later, you don't have to appear here saying that you being cited for a breach in the procurement process or any other thing that will warrant the ministry to be called before public account. This is just...
That, Mr. Chairman, just to add, it was not in anybody's interest to even, some of these things are national security sensitive, not in anybody's interest to even put some of these issues out there. Mr. Chairman, when you go to a ministry and you are solving problems and stories are being planted in the media as though you are creating the problems, if you decide to keep quiet, you dig your own grave. So some of these explanations are sometimes needed for Ghanaians to understand what you have inherited and how you are solving the situation. It is not, I mean, the story has been planted for a very long time. We just came out 2-3 days ago. And so I thank the honorable member so much for her fantastic advice.
All right, the Honorable Gape has a question.
Minister, thank you very much, being courageous and being factual, and then fact is fact, and then you brief the committee on better and further particulars. Thank you very much. This is a public interest question. Health insurance vis-a-vis your ministry, there are services they are providing, but patients are still paying. For instance, like pregnant women, but free maternal care. And it is happening all over the country, especially when you look at Joy FM documentation on pay or die. It is evidence. 37 Kolebu teaching hospitals, and then their patients are still paying for services that's supposed to be free. I would like to ask you, what strategy or steps are you taking to address this for Madagana?
Okay, Mr. Chairman, when you are put in a public office, you identify challenges and your responsibility is to face the challenges. When we took office as a government, some of the challenges facing national health insurance, 1 was the delay in payment, 2, the capping, 3, unrealistic payment of tariffs, and then the 4th one is what they call, they've given it a very nice name, but it's not a nice thing, co-payment. And so when we took office, we've taken our time to be taking the problems one after the other. Now, new tariffs have been developed. Now, the uncapping has been done. Now, we have prompt releases. What is left, and I must be very, very honest with the committee, is the issue of co-payment, where in some cases, when you go to some facilities, though you have the National Health Insurance card, so we have stakeholders engagement, it has come up strongly. And so I will allow the CEO to throw light on the strategies we are adopting, what we are doing at the moment to deal with the issue of co-payment. CEO.
Thank you, Chair, and thank you, Honorable Minister. So as Honorable Minister said, there were a few issues that were bringing this up. The irregular payments, which now we're paying monthly. The service and medicines tariffs have been reviewed. The medicines tariffs are now realistic and have been in place since March this year. The service tariffs will be implemented in a few months after Honorable Minister and the board approve it. The third one is that even despite us doing this, as what has been mentioned, some of the facilities have people who still collect monies, and they call it co-payment or top-ups. We've set up a committee to deal with this, and we have a strict sanctions regime. So once we are also doing our part, paying regularly and paying realistically, as soon as we realize that these facilities are collecting monies which they term co-payments, which are illegal payments, we will apply those sanctions that are in our law. And it could include getting them off this scheme, which is a very important scheme. So we want to actually also name and shame. For example, I want to put it on record that Goso Hospital, they have clearly stated that they will not allow top-ups, and they are implementing that. So we are encouraging the hospitals, and there are quite a number of them, we are encouraging the hospitals that have put this in place, and we will sanction those that are doing the wrong thing. Thank you, Chair.
Please, what is top-ups in the hospitals? Yeah.
So it's the same as they have different names. So it's the same as the co-payment and the illegal payments.
You mentioned co-payments as if it is legal, so that's, I like the way you say illegal payments. They also, you don't even call it co-payments, illegal payments, because you are not supposed to pay if you have a working insurance card, right?
So,
Yeah.
Mr. Chairman, let me use this opportunity to commend Goso District Hospital highly for the strategies they've put in place to make sure that co-payment is not happening, and to assure the committee and the whole country that we are coming after the facility.
Yeah, so Minister, thank you very much. It's a role model, so you need to not go beyond the recommendation and do something nice for them to project them as best practices for the country. And also to the National Health Insurance Board, apply the rule. Enforcement of rules and the laws is killing this country. And I will implore you to enforce the law strictly, and then so that at the end of the day, to serve as a deterrent for Madagascar, because the lot is being wasted in the system. Thank you.
Minister, University Government Hospital is waiting for you, as well as the 100-bed district hospital in Ninim. We are in your hands. You understand what I mean.
Very well,
Thank you.
Mr. Chairman.
Hey, you know how it is. Everybody knows how to do your job. Oh. So they get there. Then they ask for the front door. Where is the front door? Okay, NHIA, you are discharged. Now let's go to Ghana College of Physicians and Surgeons. Did they show up? Ghana College of Physicians and Surgeons. Are they here?
Yes.
Oh, all right. Could you please introduce yourself to the committee, please?
Mr. Chair, I'm Simon Peter Kwame, the head of accounts of the college.
Good morning, Mr. Chair. My name is Richard Adanu. I'm the rector of the Ghana College of Physicians and Surgeons.
Thank you very much. Your financials is on paragraph 728, and Honorable Frank Yeboah will take.
I've gone through your accounts, and in my opinion, you're not doing badly at all. I just want to request that you take 120 seconds to explain to the committee what you do and your mandate to do what you do. Thank you.
Right, thank you, Mr. Chair. So the Ghana College of Physicians and Surgeons is the national body for providing postgraduate policy, that public health policy that's led by the Ministry of Health, and also to promote research in medical and surgical disciplines in the country. So that is what our mandate is, and we do that by conducting exams for doctors after they finish their house job. They do an initial exam that we call the primary examination. After they pass that primary examination, we have panels from the different specialties that interview these successful doctors. Then we place these doctors in hospitals where they do their training. And at the end of their training, there are two levels of the training. The first one is a 3-year training, in one that is about, let's say, 2 to 4 years. And then after that, we also do where the program, we are in a new location for about 3-4 years. About 3-4 years. When the training ends and you say, go back, sometimes it's very disruptive. Try to get a specialization training spread all over the country. I've done more than 120 seconds, but that's it.
Thank you very much. And I'm glad Minister isn't just right beside you, so it's very good.
Okay, Mr. Chairman, just to also add that, just as the rector indicated, at the moment, the training is centralized. The training is centralized in Accra. But fortunately enough, the Mahama Cares is dedicated towards the funding of non-communicable diseases. So we are in touch with the college And the college has indicated that there's a huge gap about specialists treating that particular disease. And so as part of the College of Physicians to be able to train more specialists. And so this next year, we are going to, spread them to Wa, Hohoi, and then Boko, right? Bolga. So we are going to start with these three, regions. And then we'll...
The middle belt is missing. Minister.
Honorable Chair, currently, we do have programs going on in the Ashanti region also. At Konfanochi is a big training center. We have, as part of our expansion, we have got programs going on at the Holy Family Hospital in Techiman, and then also at Eastern Regional Hospital in Koforidua, in addition to Kolebu and a number of other hospitals in Accra. So we have been working on this gradually, but then it will help. That's why we are looking at that. Yeah, thank you.
Okay. I just one question. I'm seeing non-tax revenue. Is it the IGF?
Mr. Chair, that is correct.
I think that you made the profit of or surplus of 3.3 million in 2022, but that increased to 30 million in 2023, representing 294.8%, which is very good. I don't think I have much to say. Your current ratio from 7.3 to 1 in 2022 to 8.3 to 1, which is also very good. You be able to meet your current financial obligations. The only last question I want to ask is the increase in your current assets. And the explanation is that there was an increase in receivables. So what's the component of your receivables?
Mr. Chair, the receivables is to do with the tuition fees. The tuition fees, which is outstanding.
So the tuition fee, is it paid by the doctors themselves or from somewhere?
So the tuition fees for the doctors is supposed to be paid by Ghana Scholarship Secretariat.
Yeah, Mr. Chairman, I'm done. Thank you. They're doing well.
I think you've answered the next management question. You were cited for uncollected tuition fees, but then if it's supposed to be paid by the government and the government hasn't paid, this one you don't have control over it, so then they can also give money to them to clear this infraction. As for this infraction, it cannot be, it will not be possible for them to clear it on their own. So respectfully, as in the spirit.
Why are you being invited? Why haven't you paid that money? I agree with you entirely.
Honor discharge. Now let's call. Those for State Housing Company, AESL, and Water Resources Commission. Those of you who are going to answer questions, could you all get ready to be to take the oath? And clerk, administer the oath, please.
Swear by the Almighty God
Swear by the Almighty God
that the evidence I shall give before this committee
that the evidence I shall give before this committee
touching the matter in issue
touching the matter in issue
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
State Housing Company. And Honorable Minister, introduce yourself and then your delegation.
Sorry, we didn't hear that. Thank you, Mr. Chair. Thank you, Madam Chair. Okay. Thank you, Mr. Chair, and honorable colleagues. Good morning again. My name is Honorable Gisela Tete Agbotui, Member of Parliament for Utu Senya West, and Deputy Minister, Works and Housing. I'm standing in for my Minister, Honorable Kenneth Gill.
Chief Director of the Ministry.
Good morning, Madam Chair. My name is Philip.
Good morning, Mr. Chairman. My name is John Bauer. I'm the Managing Director for State Housing Company.
Good morning, Mr. Chair. My name is William Kali.
All right. The paragraph we are going to is on paragraph 1353, and Honorable Abena Osei-Asare.
Should I pass it on to you? Because John and I were primary school classmates, and
Wow.
yes.
And you know Reverend also.
Reverend, I know from the ministry. And
Okay.
John and I, primary school classmates. But that is good. There was an improvement from 2022 to 2023 in terms of your turnover and your expenses and to sort of close the housing gap that we have in this country.
Around 1967, as the development arm for the government. So mainly they were tasked with building and civil servants and the like. Over the years, the organization morphed into first a corporation and then eventually into a limited liability company around 1997. Stands today is to be able to provide affordable and sustainable housing to the majority of Ghanaians in areas that give them a sense of pride of place. So that's basically what we do. Our mandate also includes managing a section of lands that were compulsorily acquired by government and placed in our care. So we provide those estate management services. So for most Ghanaians who own or have leased government lands, their leases and tenancy is managed by State Housing Company Limited. In support of the ministry's objectives, we are one of the development arms under the ministry, so TDC being one, and from the technical side, our colleagues at AESL and the other agencies support the ministry in terms of delivering as many housing units as possible. It is important to put on record that State Housing, however, is not a subvented organization. All of our activities are financed internally through internally generated funds. Thank you, Mr. Chairman.
Double housing coming on so that Ghanaians listening will know when to come to your outfits for. Yes.
It's arguable. However, we are working under the ministry. The ministry has quite a lot of significant major housing projects, some of which form part of the Big Push agenda, which are coming on stream soon, and we are one of the lead agencies in the...
Thank you.
All right.
Thank you very much, Mr. Chairman.
May we have AESL, please? AESL, could you introduce yourself to the committee, please?
Okay. That's it. Yeah. So my name is Surveyor Gordon Tanga, the acting managing director for the company.
My name is Architect Nakwa Alikwoti. I am the Deputy Managing Director of AESL.
I'm Alhaji Ibrahim Jibril, Acting Head of Finance.
I'm Seth Ufurulavi, representing the external auditors.
I'm George Kwashe, representing the Audit Committee, AESL.
My name is Abdul Latif, Accountant, AESL.
Honorable Frankie Abua will go through the financial.
AESL. I've gone through your financials. I've not really seen any much problem, except to say that Ghanaians don't really know your mandate and what you do. So in less than 120 seconds, can you walk us through what your mandate is and what you do? Thank you.
Yeah, thank you, Mr. Chairman. So the Architectural and Engineering Services Limited was carved out of what was then known as the Public Works Department in 1973. And the mandate of the company at the time, which was actually called a corporation, was to provide consultancy services on government projects for various ministries, departments, and agencies across the country. That mandate remained until 1993, when we were converted into a limited liability company. What that meant then was that we were no longer, the various ministries, departments, and agencies were no longer obliged to necessarily engage AESL to carry out any consultancy services. So we're then competing with other consultants in the industry. What that also meant then was we became a purely commercial entity, which meant that we could be sued, and then we could also sue people who were owing us for any services that we provided, and payments were not coming. So we still provide the same service that we for jobs.
Thank you. Your 120 seconds is up, so that's fine.
Thank you.
In that case, since you are now a limited liability company, where I'm seeing an increase or a decrease in your revenue, where we'll get funding from the government. Aside the revenue, 21 million, I'm seeing other income. Where is that one coming from?
Honorable Chair, we have rent income. That we have some spaces we rent out.
Your rent income went from 1 million in 2022 to 276 in 2023. What happened?
Honorable Chair, we have other source of income apart from the rent income.
Yeah, I wanted the component of the other income, and you said rent income is included. And our chairman is asking you that in 2023, it came down to 276,000, and he's asking why. Is it the case that the people are no longer renting?
No, they are renting. In fact, we have rent. The other component of other income, rent, interest,
We have certificate fees and contract fees too. We also get, and then sometimes disposal. The component of the rent actually even dropped.
5,000, representing 154%. That is very good. And let's move to your financial position. The current ratio has improved. It moved from 1.3 to 1 to 1.4 to 1, which implies that you will be able to meet your current financial obligations. So I don't think, Chairman, I don't think I have much to say. It's okay. You're doing.
ASL, finally, I have seen that you have included toilet facilities in your classroom drawings. It's been how many years? Decade. From GetFund. GetFund awards a contract for maybe a district or a constituency to build schools, classroom blocks. And previously, toilet facilities were not attached to the buildings that you design. More exciting. Moving away from the old structure, just one straight jacket thing. The schools should look exciting. I don't know if you also do the hospital drawings and the other drawings. It should look a bit exciting than the flat buildings we have. And I know you are responsible for the drawings that we see of our public, most of our...
Madam Chair, sorry. We've moved away from that long ago. I think, I don't know whether you have seen our current designs, but we have moved away from what you are saying long ago. We are now, when it comes to design, which design you are talking about?
2 years ago, I mean, we were awarded a contract. It's the same, this, that.
Designs has to do with, you take into consideration costs. So sometimes, depending on how much you want to spend, is ready to spend. So we consider all those things, and depending on how much your budget is, it will influence the kind of design that's.
Yes, but Madam, if we have to build for I wouldn't say eternity, but for a long time, we should not just look at the cost only, but the conduciveness. And you know what I mean. I mean,
Yes.
I'm not saying we should compete with them, but some of your drawings, I mean, a year or two ago, you go to. We all know the schools, the public schools in some of our constituencies, the buildings, for lack of a better word, I'll say they are very flat. So I'm happy you said you are moving away from that. And I'm also happy that these days you are including toilets as part of the school building facilities.
Thank you, Madam Chair. We'll consider everything you have said here.
Madam Chair, Mr. Chairman, sorry. Just to add something to ASL's mandate, that they are present in all 16 regions. So, and their technical services are available also in that same way. So, they are one of the few organizations whereby they have a presence nationwide. So I'm just putting this out there to the general public that their services are. It is a range of engineering, geodetic engineering. There's a whole range of them, and then quantity surveying services. The quantity surveyors are like the accountants of the also look better in the coming years and be able to get more services and more work to do. I think ASL maybe soon they'll start coming out with various catalogs of their designs, 2026, 2027, just as the fashion industry does. I think the architectural space should also do the same. I agree. Thank you.
All right, ASL, you are discharged. Now let's have Water Resources Commission.
You are thereby challenged.
Okay.
Thank you, Chairman.
Have you guys taken the oath? Okay. Could you please introduce yourself to the committee?
My name is I'm Kakarichum,
Principal accountant.
Okay, Ghana, of your area. So far, you are doing well. What constitutes other revenue?
These are donor funds that we receive from our donor partners.
It's what?
Donor funds.
The donor funds.
Yes, sir.
And why did it increase so much from 2020?
Okay, we submitted proposal to our donors seeking funds to help us undertake a series of engagements with stakeholders and traditional authorities.
Well, maybe you need to send more proposals because a difference of 3.5 million cedis, that was quite a lot. Now, after your revenue, now let's look at the expenditure. What caused administrative expenses to more than double?
One of the reasons is due to the Akosombo spillage. So we had to do a lot of ground, and also due to the increase in the donor funds, we were able to undertake a lot of donor activities.
Okay. So now let's look at the financial position. 2022 is 3.71, and then there's a current ratio. And 2023 went to 2.5 to 1. What was it? The current assets, you see how much it jumped? 156%. Why so?
Okay. The increase was due to the introduction of our new LI. We introduced our new LI, that's the Dam Safety LI, and it was introduced as part of our fees and charges, so we were able to generate more funds from that LI also.
So regulations help. Okay. Now you have a management issue of unqualified suppliers. 57,000.
Honorable Chair, this happened as a result of our substantive procurement officer going on maternity leave. There are suppliers that we've been dealing with previously, and so the one who took over felt they already have the documentation for pre-qualification.
Now, these suppliers, it says over here they did not submit the mandatory documents such as GRA. Have you now submitted these?
Ghana electronic procurement system.
Okay. So you've corrected this anomaly?
Yes.
Please.
Yes, Honorable Chair, verification indicates that these suppliers are now on GANEF, and they are dealing with suppliers that are listed on the procurement electronic system.
All right. Go and sin no more on this one. Water Resources Commission, you are discharged. And
Thank you.
Honorable Minister, you are discharged also. I'm sorry, Community Water. Yes. Under the ministry. I'm sorry, please introduce.
Acting Chief Executive. Director of Finance.
Auditors, community water. You see, there was an issue about community water, whether they're on Monday.
Works and housing.
It's under works and housing.
Yes. So their issues are in the MDA's report, the water systems.
MDA's report. Okay, so Ashanti region, where we have the Kokofu water system, is that under you? And what is it? Who is it under?
Honorable Chair, that one falls under the District Assembly.
So local government.
Local government.
Madam Chair, I think there's a high time we make sure that at least we bring all. Otherwise, monitoring and tracking will become very difficult, very, very, extremely difficult.
Yeah.
So the few that are still left with.
Just a minute, we'll resolve this issue easily. Because water, some of it is under local government, some of it under your ministry. So we'll just resolve it, just give us. Water and Sanitation Agency. Western Regional Sangregua, is that under you? For uncollected revenue of 113,000.
Honorable Chair, as at December 2024, the water system was able to retrieve an amount of
463 has been recovered.
What about the rest?
Honorable Chair, these are domestic subscribers and institutions. And with the domestic subscribers, we have been following up. We have a payment plan scheduled with them to collect. But with the institutions, it has to be paid through government, so we are still waiting on government for the payment.
How much of this receivable is for domestic households and then those for institutions?
About 60% is for the institution.
40% is on domestic.
Yes, sir.
And the institutions, you are waiting on the government. Hey,
Exactly.
Sir,
So, good.
this is unlike areas where it is specific. What government gives to you, you can use a part of it to defray the cost. So it's not like government will give you money specifically to pay this, but government makes budgetary allocations, and you have that opportunity to use some to defray the cost, or that is not the case.
Have the payment made to us.
Doesn't government, you said government pays on their behalf, didn't you just say that?
Exactly, but this done.
Oh, but the institutions also receive their budgetary allocations. And for goods and services and some of these things, they consistently, every ministry, department, and agency that appears before Parliament for their budget, there's a portion for goods and services. And the goods and services are supposed to be used to pay for utilities as well. So to sit here and say we are waiting for government to bring money, this is not like scholarship secretariat where it is specific. So once they receive their budgetary allocations, they are supposed to go after them because services, and they are supposed to use some to pay for these things.
Chairman, uncollected fees of 70,000.
Honorable Chair, it is fully recovered.
Auditors, could you confirm, please? All right. What about community water and sanitation at Wale Wale? That is under you also, right? An unrecovered debt of 342,000. What has happened to this amount?
Honorable Chair, the water systems, Ghana cedis, 33 pesos.
Now, what about the rest of it?
It is the same issue of the schools that we supply water to. So we normally have to wait through the Free SHS Secretariat to make payment.
You don't have any households in here? But Free SHS just made a huge amount. I sent a lot of money to the schools.
Okay.
So, as of December 2024?
Yes, sir. Yes, Honorable Chair.
Master, could you speak out? It says 58 institutions and individuals owe the agency a total of this amount. Management stated that they would develop the necessary strategies to collect all monies owed by customers in due course. What about Savalugu? They also owe 95,956.
Honorable Chair, Savalugu is not under the management of Community Water and Sanitation Agency.
Hey. So who is it under? Okay, Chief Director wants.
Honorable Chair, I want to make this clarification. We have over 1,000, almost 1,000 of them are under the District Assembly's management. We only have 198 that is being managed by the Community Water and Sanitation. So, under the new reforms, when it is done, then the CEDO, because now there's a confusion, so we are going through.
Water system, is that under you?
Honorable Chair.
6,000.
Honorable Chair, as at December 2024, an amount of 98,040 cedis has been recovered.
Auditors, could you confirm this amount, please?
Yes, Honorable Chair, an amount of 98,040 cedis has been recovered.
And I'm sure the story is the same.
Honorable Chair.
Okay, what about God's water system? Is that under you?
207,000.
Oh, you've done very well on that one. Great. What about Kukum water system?
Honorable Chair, Kukum Water Systems has been able to recover an amount of 42,123 cedis, 60 pesos.
What about the rest of it?
A payment plan schedule has been outlined for the collection of the outstanding receivables.
Okay, now what about Sankore Community Water and Sanitation, 1,745 Ghana cedis?
2 pesos.
This recovery.
Sankore has a very peculiar challenge. We have a peculiar challenge in Sankore.
Okay.
when CWSA took over the management of Sankore water system, there were debts owed the management at the time to this huge tune. The customers claimed they have paid, but there were no receipts to support it. So we began the process of taking the officers who were managing the water system to charge, to pay back the money. Unfortunately, one day organized tax, they went to our office in Sankore and drove out our staff and took over the management of the water system as we speak. And the matter is with the police. It looks as if nobody is interested in helping. So we have also decided not to put our work.
Always known you as an action man. So to say that you are not going back to Sankore, please.
Madam Chair, you know, the law that established community water was supposed to facilitate the provision of water for the DC assemblies and the community to manage. Over time, system left to rot became the order. And so in 2017, they began the process of taking over the system money to the electricity company and even the management themselves, including some of the chiefs, were just squandering the money and leaving the assets to rot. So currently, like the chief director said, water system, that's the only way we can enforce these infringements. We hope that...
We will also support you.
Yeah, we hope that when it comes to Parliament, you will help us to get it.
Yes, we will also put it in our reports and draw Parliament's attention to it whilst we wait for the law to also come in. But it is very important that you take over and manage it efficiently, not just with the revenue collections, but also with the protection of the assets as well. Thank you.
So the domestic, those customers, 683 of them, they owe 384,000. Institutions have, there are 9 of them that owe 15,000. And commercial is 5 that owe 6,000. And if you recovered 80-something thousand. Now, was that from the domestic people or from? Most of it must be from the domestic people.
Honorable Chair.
Okay.
You are right.
So, Chief Executive, I will wait, and the Chief. Okay, Honorable, any other?
Hey, who wants you to go in? To those who attended upon Ministry of Works, Housing and Water Resources, we are grateful to you for attending upon us. We thank our auditors, our media people, and our members. Tomorrow we will look at Ministry of Justice and Attorney General's Department. Under that, we have the Copyright Office, the Legal Aid Commission, the Office of the Registrar of Camp. Then we also have Ministry of Environment, Science and Technology. Under that, we have the CSIRs and other public institutions. And then we have the extra-ministerial agencies, the PPA, PURC, and the Environment Ministry, because the same minister takes care of the Environment Ministry, and then we can attend upon them on the issues that had been raised in the reports that we couldn't meet with them yesterday. So on this note, we'd like to bring today's meeting to an end, and thank you all for coming.
Citizen TV, Accra, Ghana. Citizen TV, the citizen's power.